With someone that is in and out of the hospital, there's no way you won't come in contact with, doctors that give you bad experiences, nurses, stuff like that. Or, and you can't generalize. But I'm going to point to something that happened, I think it was sometime early last year, the last time I was hospitalized. And it was the emergency room, the medical center right there. So I'm going to give you guys the tea. Don't tell anybody. But so I noticed that, and I'll touch on that later, but I was at work. I work in finance, so you have to wear the suit, the tie where I worked at the time. And I had a flare mid-work, and I had to rush to the emergency room. And now, because we all know how expensive the ambulance is, I drove myself because I'm not paying that. So I got to the ER, and I guess because of how I was dressed, sometimes they won't take you seriously if you don't look bedraggled, if you don't look crazy, or if you're not screaming in pain. That's something I've noticed since I got here. They won't take you seriously. So, and I was put together because of course I'm coming from work, and I get there and I wait maybe 9 hours, and I'm not joking. There was someone else there. She had sickle cell, but she wasn't there for herself. She brought her boyfriend in. So she saw me, she was like, "You have sickle cell, you're in pain right now." I said, "Yes." She said, "Did you tell them?" I said, "Yes." She said, "What's going on?" She said, they go by priority. I was like, "I'm in pain. I feel like I'm dying right now," but I guess because I'm not screaming and rolling. And so I was there so long. My little sister, who's in the audience here right now, a very helpful person, she leaves work and she comes to join me. My mom leaves work, they come to join me, but I was there for a long time. And when I finally go in, because they have to triage you first, mind you, someone's dying in pain, you're triaging them. The person comes in, I guess she's a doctor, but in training, I'm sorry, a resident, maybe, I forget. Grey's Anatomy is not helping me right now, but she comes in, they do my vital, and then she asks me this question that makes me go blank. She said, "How long have you had sickle cell for?" Swear to God, I'm not even lying. And I was like, "How long have you had sickle cell for?" It's like, "The disease or the pain?" She's like, "Both." "Oh. Well, since I was born, and the pain since 9 hours ago." But again, that question scared the hell out of me. Because when in 2026, you're a resident, you've come this far, you don't know that sickle cell is genetic. You don't know, you're asking me how long I've had sickle cell. Because I had her repeat herself, because people make mistakes, there's a lot going on. So, and she repeated herself, meaning she genuinely did not know that sickle cell is genetic. That was one experience that I made a deal with myself. I said, "You know what? Unless I'm dying, unless I can see the Grim Reaper, and nobody do this, it's wrong. But I said, unless I see the Grim Reaper, I'm not going to the ER." So we ended up not getting seen there. So we're there for 9-10 hours. My mom came and she's like, "You know what, let's try Westchester." And we went there, and it was a whole long wait, because there's other people too, so don't get me wrong, I don't expect you to throw everyone away, but there's people that I'm sicker than that are going in. So that experience, you're already in pain, it humiliates you. It makes you feel like they're not taking your pain seriously. So I've had experiences like that just throws me off. So I'm grateful for this program. I was here last year. Yeah, last year was my first time, so this is my second time. So I like that. I really appreciate that you are interested in our experience. You're interested in hearing from us, because this would shape how you treat patients in the future. Because now you've seen how it feels, to sort of live like this. So, I don't know does that answer your question? But yes, that was one of the most remarkable experiences I've had. There's more, but I won't bore you. That's the most recent one.
We got another question. She's coming to you with the microphone.